Nasolabial folds, horribly deep at only 33. I'm only 33 years old, and I always looked young for my age up until about 28. Then, wham, nasolabial folds. Worse than anyone I've ever met personally. I feel I look 65. My self-esteem is in the toilet. If I gently pull them back, I look 100% better. My question for the doctors is, looking at the picture, do you think I can be helped with Juvederm and/or similar products? How many syringes would I need for these ugly folds to be eradicated?
Thank you for your question. You're 33 years old, and you stated in your question that you always looked young and you looked good until the age of 28, where things suddenly changed. And you're concerned about how deep your nasolabial folds are, and you feel like you look like you're in your 60s, and you're asking about the number of syringes needed to make a correction. Well, I can certainly give you guidance as to how I approach patients who come to me with this type of problem in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. Dealing with issues related to facial volume is a very significant part of my practice. We use a lot of different fillers, and I think it's very important that you have a sense of what is ultimately a good strategy to address the issues that concern you. So, understanding that, yes, the nasolabial folds are deep, I would say to you that when I look at patients who come in and say that they have this concern, when you look at yourself, naturally your eyes go towards those folds. And there's no question about the fact that they have some significant depth. But what I'd like to point out to my patients is when you step back and you look at the face as a whole, you look at the areas, particularly around the eyes and the cheekbones, and see how that interfaces with this area where the folds are. You see, most people, in my experience, focus in on wrinkles, on lines. This is kind of a very significant aspect of aging that people find very distressing. But one of the things that, especially in a situation for a younger person like yourself, where age-related changes are not as much of a significant issue, but rather maybe the genetics of facial fat volume loss, or if you started to really exercise aggressively and change your diet, maybe the volume in your face is diminished. If you look at the nasolabial folds in isolation, certainly there are a wide range of options, and whether it's fillers that are placed deeply as well as fillers that are placed superficially. But I would say that one great strategy, what we do in our practice that we use, is something called structural volumizing. And basically we're focusing on the volume loss at the bone level and above the bone level. What does that mean? When you look at your photo and you look at the under eye area, at the cheekbone area, there's a certain degree of flatness there. So when you look at maybe some understanding, or you think about the understanding of volume loss, then the folds and that area in combination contribute to your concern of your appearance of looking a little bit older. So my approach to you would be to recommend a more global approach, and that global approach would include placement of fillers at the structural level and in the cheekbone area, the under eye area, as well as in the nasolabial folds area. And this is where the art of fillers really is extremely critical. So yes, you would need a decent number of syringes. I would say, yeah, and think of syringes not just in the number of syringes, but actually the actual volume. The volume of each syringe, let's say of a filler like Juvederm or Restylane, is about 1 milliliter. And so when you think of 1 milliliter, that's not a lot. Usually these fillers provide a fair amount of correction if you're only treating superficially. When you treat at a deeper level, as would be the case in the deeper part of the nasolabial fold, where I would actually place the filler at the bone level to give you some more projection and try to fill out that fold rather than staying superficial and just trying to soften that fold, then you need a reasonable amount of volume. But this is more of a discussion about the concept, and then you can decide with your doctor what you're comfortable with in terms of how much volume you're ready to start with. And then placement of volume at the cheek level would be of a filler, like a thicker filler, like a Juvederm Ultra Plus, a Juvederm Voluma. And then in the under eye, in the trough or the V deformity area, then a filler like Restylane or a softer filler like Restylane or Juvederm Ultra would be of benefit in that area. There's a lot of options and there's a lot of judgment involved, and a proper examination really gives you more definitive answers. So meet with some doctors, get some opinions. I think you'll find yourself somewhat surprised at how many people come up with different ideas, and you have to basically be able to envision it yourself. When I show my patients my thinking, basically what I do is I take their photos, I put it up on a screen, and I show them what I'm thinking, where I think the volume benefits can be. Because a lot of times we look at things that bother us, we magnify that, and then we lose the forest for the trees. And so when I take the photos and I show people what they look like from different angles, there really is a very important and significant educational experience to be able to see the global issues and what can really help you look as young as you are and not look older. So meet with some doctors, learn about your options, learn about structural volumizing, and then begin your journey, and hopefully you'll get to a place where you'll look as young as you really are. So I hope that was helpful. I wish you the best of luck, and thank you for your question.